I think one of our biggest advantages is that we have been doing this for a long time, and we have been doing it well. Our program has been groundbreaking program throughout the years, always establishing novel strategies from the surgical end, from the medical end, looking into immunosuppression or different things that what can we do to be successful, to improve results. And I think throughout the years, our program demonstrated that we has established approaches to the problem of transplantation that have moved the field. And I think anyone in the States understand that, and we have a national and international reputation in regard to that. This is a program that you look up to, truly, because you always wonder when you are in the field of transplantation what Nebraska is doing regarding transplantation. I think the fact that we are always looking for ways to improve ourselves is what makes us unique. Is that we don't get to a point that we'll feel comfortable with what we're doing. We always look at things that may emerge during the process of taking care of patients or doing a surgical approach to things, and try to see how can we make that better. The interesting thing in pediatrics is we have all this variety or diversity in the population. We have patients that they don't understand what's going on, and they are patients that they understand some of what's going on, and the older patient that fairly understand the majority of it. Then in the process of how you're dealing with that, you deal with it differently. Obviously, parents have to be involved in the decision-making process since you are talking about minors, but sometimes you have patients that are too young that they cannot understand. And those patients, initially, they have different challenges. And I think one of the more important challenges on the long run is how you pass on to them the fact that they were really sick in some point in their life as they hit the teenagers, because they don't remember sometimes they were so sick, and they have been doing so well after transplant that they forget about it. They don't really have that experience. Sometimes if someone has gone through the process of feeling sick and remembering that, they tend to be more compliant with the treatments and things like that. But getting them involved is a team approach. Everybody comes, explain their part. We told them to write questions as they go through the process of the evaluation of transplantation. It's a lengthy process, but they have plenty of opportunity to ask questions. And I think by advising them to write down their concerns, questions, I mean, they can address them. At the end of the day, what we want is that they feel comfortable with the decisions that we are making as a team, and in that way, you ensure that you increase the likelihood of success by addressing all those little details and the understanding. The parents really have to understand what this process is going to be and the long-term commitment that this implies. We are dedicated people. We'll always try to make you feel at home. We have the experience of having people that they are not from this area, and we have a great understanding that sometimes they come from all the extreme, from the East Coast, West Coast, and they are outside their home environment, and we are very sensitive to that. We deal with kids that are extremely sick. Sometimes we deal with kids that no other programs would like to deal with because they are too complex it could be the experience that we have, the fact that we always want to be challenged in what we do, that really we like to take those tough cases because at the end of the day, what we have in mind is how can we help families? How can we make your family better? Our main goal is to send people back to their home, wherever that place is, and have a family back, and they can enjoy the time with their kids as they are supposed to.